Good afternoon, everyone, and welcome to our Q&A for this afternoon. Life Tech, helping people with IDD identify and learn the right technology to support their best life. Without further ado, I would like to introduce Chris Helmick, Manager of Assistive Technology Innovation and Research, and also Gabrielle Zarek, Director of Transition Services. Welcome.
Hello, thank you. Thanks for having us.
You
I'm really
bet.
excited to be here. So I'm excited to talk to everybody today about a new program that we are going to be launching this summer, and it is going to be available to participants in St. Louis City, St. Louis County, and St. Charles County. And just to give you an overview of what this is going to look like, so we are going to have kind of three tiers to this. The first tier is going to be working with individuals with IDD, and we will be doing an assessment to see what is the best technology that somebody could use in their life to achieve goals towards independence. So we would be looking at possibly doing ISP addendums to help identify certain goals, and then we would find technology to help reach those goals. And we would also provide training with assistive technology specialists. That would be one-on-one training. And we will also provide multiple trainings and then do an evaluation to see that the tech is working well. And then after we get the training done, we will provide a year of help desk support for the individual. So if there's any ongoing issues later on that arise, they would be able to contact the help desk and be provided assistance through that means. So we would have 3 assistive tech specialists that would be available to go out and do these assessments and these trainings. The second piece is our community collaboration piece. So with this being in 3 counties, we do realize too, there's going to be a lot of other agencies that are going to want to get involved in this. So we would be working on creating agency collaboration meetings and getting different voices to the table, but also different type of resource sharing that could be out there and available. We would also do an inclusive tech training series, which would be available to the public. So it could be for caregivers, it could be for parents, it could be for staff, it could be for individuals, really anybody that wants to attend. And it would be a wide variety of topics, very basic technology needs to more advanced technology needs. And then we would also, this person would be focused on our community partnerships with universities and different vendors as well. And then the third piece, which is also my position, is always kind of looking towards the future. So continuously doing research into new technologies, but also existing technologies that are maybe not being utilized in the best way. Also doing beta testing for new technologies that are out there. And then looking at the data and analytics that we get, like if there's any ongoing themes that we're seeing, or if there's anything that we might need to address as the program is up and running. Also leading the team as well.
Yeah, we're really excited to bring this to St. Charles, St. Louis County, and St. Louis City. And we have to give a huge shout out to our funders to make all of this possible. So Productive Living Board, DD Resources, and DDRB. We're really excited. We've been hearing so much we've seen, within the St. Louis ARC, and even, with a lot of partnering agencies in the St. Louis area, there's so much virtual, and technology in our world just continues to evolve. So we're really excited through this programming that individuals will have access to getting a lot of different technology solutions that can really help as individuals are working on goals and working towards their outcomes and getting that technology. So like Chris had mentioned too, even with the community collaboration portion of it too, we'll be working with partnering agencies in those 3 counties, really ensuring that there's equal access to the program so that those tech solutions, individuals will have access to that.
And so the target population that we're looking at is any adults over the age of 18. We would encourage anybody under 18 to access support through DESE. Any individuals that qualify for SB 40 funding through St. Charles County, St. Louis County, and St. Louis City, and also do not have a Medicaid waiver.
And so how Chris mentioned in the a couple slides ago how we will be doing some initial piloting and testing of the model here in the very near future. So before we get to the end, I know we've had so many people reach out and excited about getting this up and running. So as we're developing and as we're getting closer to that too at the end, we will share the email address as well if you or anyone that you know is interested. So that will be coming too, because I know that that's been an eager question a lot of people have asked.
Yes. So one thing we did do as well with this funding is we wanted to make sure that we identified what it is going to include and what it is not. Because when assistive technology is said, it can mean a lot of things to a lot of different people. So what we are talking about when we say assistive technology is different hardware and devices such as computers, tablets, laptops. So this could be for multiple type of goals as far as helping people get the devices, but also get the training on how to use those devices. Any kind of non-subscription applications or software. So we wouldn't be doing anything that's going to be on an ongoing subscription, but if there are applications or any software that we feel would help reach these goals, then we would be providing that as well. Different types of smart home technologies also could be utilized in this because there is a lot of different types of smart home technologies, and we realize a lot of people use different types of smart home technologies for different reasons, and it does make life a lot easier on living a more independent life. Also looking at newer technologies like virtual reality and augmented reality, there's a lot of really cool new things that are coming out with that. So we want to make sure that we are testing and seeing the different ways that we could utilize that type of technology. And then things like electronic medical devices. So things that could be used possibly with like a teledoc service, or also health and wellness devices. So something like a med dispenser or something like that to help somebody that maybe needs a reminder to take their medicine at a certain time. Things that wouldn't be included is adaptive equipment. So this wouldn't include things like lifts on cars or lifts at buildings, any kind of durable medical equipment, or any kind of comprehensive home modifications. So we have gotten some inquiries about things like smart thermostats and smart doorbells, and we have looked into those. If it did require us to do any kind of home modifications, then we would not be able to provide that kind of service.
So these are all possibilities. There's so much that really could come of this, just based on the individual and what goals they're working on and support needs as well. So it really kind of gives like the high level scope of what technology that we're talking about. But each assessment is done individually with one of the assisted technology specialists on the Life Tech team. And so having that individual time to really go through the assessment and look at that. But all of the tech solutions won't be identified until after the assessment. We really want to make sure it's not only individualized, but taking the time to walk through that so that it's really aligning with goals and outcomes and supporting folks in utilizing tech to be more independent in various aspects too. It's also important to know too, I know there's, especially when you look at things like virtual reality and augmented reality, there's so much in our world with tech, and sometimes that can be tough to learn or tough to understand. So that's also why after the assessment and after those potential solutions are identified, individuals would have one-on-one trainings with that assisted tech specialist as well, because sometimes it's not always getting the technology, but it's really knowing that individuals are feeling comfortable and confident and how to use it. And so being able to have that training portion. And then we recognize it's technology. There's always going to be something that pops up, or a question, or it's not working one day. And so that's where the help desk support will come in too, even after those training sessions occur too, because we know there's always going to be something that pops up. So that support will be available too following.
Yeah, it was very important for us to provide a training piece to this program, because we didn't want to see devices and technology get handed out and then there was no real follow-up or no real good training on that, because technology is tough for everybody. I struggle with certain new technology sometimes. Nowadays, it's a little bit less because it seems like most things keep coming through my hands at some point, but it does take, you know, a little bit of time to learn something new and to get used to it. So we want to make sure that we're doing our due diligence and making sure that that training is provided, and the resources as far as any kind of extra training materials will be provided as well through the assistive tech specialist. If anybody has any questions or wants to reach out, we are going to be looking at piloting this program this summer. So we are taking emails to just start kind of making a list, compiling a list for individuals that we would want to bring into the program, possibly for beta testing, but also just as we get things up and running, just so that we can have a list of people that we would contact once the program is ready to go.
So I have some questions. First of all, I am just so excited about the potentials for this program and how this is going to reach people. Do you have an age limit on the program as far as on the upper end?
No, it is just 18 and over, qualify for SB 40 funding and no Medicaid waiver.
And would this program possibly be available to folks who are receiving county board funding for staff support, but they are not in residential care and not getting a waiver?
Yeah, so so somebody would need to be SB 40 eligible, and if there's any concerns of if somebody isn't sure, that's where I would say just recommend and send us an email. It's lifetech@slarc.org, because when we first reach out and inquire, the LifeTech team will walk through an overview of the program to know what to expect, but then also we'll walk through those eligibility questions too, because sometimes there can be so many details and all that, that sometimes it's, well, we're just excited to talk to you and walk through that too. So if there's any eligibility questions.
I just think it's exciting because I can see some increased possibilities for people who are living in the community, but need just a little bit more than the boards can support. But some of that technology may be able to provide some of that support, which I thought could be pretty exciting as well.
Yeah.
We have a couple of questions from the audience. Will lessons learned with this tech be shared with other departments at the ARC, like residential, day programs, et cetera, so that they can utilize tech too?
So we would be any other programs that have a participant that qualified, we would take referrals from other programs, as well as outside agencies. But we would be creating a resource library that would be shared internally as well as externally.
Yeah, so there's a small group of representatives from a variety of different departments within St. Louis ARC that meet on a monthly basis to share ideas and resources, and then also update each other on what departments are working on, because it can vary so much from program to program. So those will continue to go on and expanding that collaboration. But then even furthering that, Kelsey is our coordinator of community collaboration, and she'll be leading all of those efforts among our partnering agencies as well. And so that will be not only internally, but externally sharing those ideas and resources as well too, because we want to ensure too that there's equal access to the program, regardless of what, you know, within any of those counties, regardless of what agency or program someone is connected to, we want to make sure that everybody has access to participate in that.
That's really exciting also. And I think it kind of goes along with one of the questions, which is, how do you keep up on current tech trends? And I would think one of those ways would be being able to connect with your colleagues and your coworkers, but there may be some other ways that you try to stay up on technology as well.
Yes, I read a lot. I probably every day I read at least, I would say at least 20 to 30 news articles about technology, new technology especially. I am subscribed to so many different websites as well, so I get lots and lots of emails about new and upcoming things. Also, tech bots do a very good job of advertising to me at this point from all the research that I've done. So I am constantly in the know as far as new technologies, but also just like you were kind of saying, having conversations with other people who are into technology. And it's really nice with this program too, because there are a lot of like-minded people that are going to be in this program working with me. So we are all kind of tech nerds, and we definitely like to talk about technology. So it's just a very all-encompassing any way you can get information available to you. But I do like to research this stuff. There is part of it too that's just kind of a passion of mine, of just wanting to know this information. So I definitely do my part in seeking it out.
It's been so neat to see the whole Life Tech team come together as we've hired and onboarded the whole team as well. And yeah, just like Chris said, with just that interest in learning with technology, but just what each person brings to the table, and yeah, that it all helps with staying on top of it, because every single day there is something new that you can learn, and something more out there. And so a lot of different aspects. There's some really great tech conferences too that we've been able to attend, both locally and nationally. But really just kind of getting a whole picture. Yes. There's always something new.
Yeah, and as for assistive technology, I would say that atia.org is one of the best sites to kind of point you in the right direction. They have a really good virtual conference, but they also have some good free resources as well as paid resources, but a lot of good information sharing on that website.
But people's brains all work differently. And sometimes when people are very, very involved in technological information, their brain works one way, but maybe they're not as socially adept because that part of the brain, it's not getting as developed as the other part. How do you all balance out all those workings and personalities with so many areas that you're actually going to be involved in, technology as well as all kinds of people, families, that kind of thing?
Yeah.
How do you balance like your team?
Well, as far as our team, I think we have a really good crew of very like-minded technology-able people, but also different types of personalities. So I think that we're going to have a really good rapport building prospects there. But I would say probably, as far as like your other part of the question, is kind of approaching it from just, there's all different kinds of learning models. So I mean, some people are visual learners, some people are kinesthetic learners, some people are audio learners. So really trying to tackle all those different types of learning, but also with this being an individualized training and a one-on-one, you can kind of more gear that training towards that individual and not make it be so wide base. But another thing we are trying to keep in mind with this program is making sure that any materials or anything that we're doing is meeting accessibility standards based off of WCAG 2.1 AA standards, which is kind of the standard where the ADA is at right now as far as a digital technology and anything that's on the web. So making sure that we're meeting those standards so that if somebody is using a screen reader, it's already built to be able to use a screen reader with, or it's going to have the right kind of contrast for people who might be colorblind. So just really thinking about those kind of things as well, so that we can come into it with a little bit better of a range to work with, but then with that individualized training, we can really kind of hone in on what the person that we're working with needs.
A lot of that will be captured too through that assessment phase too, because it looks at all different aspects, you know, both based on like what current technology is the individual using, or what do they feel most comfortable with. So, you know, if, for instance, like if we were supporting an individual who, you know, maybe there's not much technology at all that they're using in the day-to-day, then that wouldn't be, you know, getting the most robust type of device with all different features and apps built within it, we would start with something a little bit more simpler and easier to use. And so taking all of that into account, even things like, do you feel more comfortable using Windows and on a PC or Apple devices? Asking all of those too, so that we're taking all of those preferences, all of those experience, that tech background knowledge, because that can vary so much on how comfortable people feel utilizing technology, what that looks like, and making sure that we're being smart with those solutions too, that it's reasonable, it's, that it's being helpful and not a headache.
Yeah, we don't want to overwhelm anybody with tech. We really want it to be something that's going to enable their life to be better. So we want to start where you're at and build on that if possible.
I got a call not too long ago, because I get all kinds of interesting calls, but this one was from a sister who was wanting to help her older sister in her 60s learn how to use an iPhone. And that's what she wanted. So, and at that point, it wasn't like this program would have been ready for her, but is that something that you would consider for somebody who already has their new iPhone?
Yeah, so it could be, because the program is not really completely meant to just like give people technology devices. It does have that training piece as well. So it's really looking through the assessment, identifying certain goals, and then providing training towards those goals. So if it is a piece of technology that they already have and we can help provide training towards that, then yes, that would be something that we would help with. But it would also be, when you say how to use a phone, I mean, that could mean so many things. So through that assessment, we would want to know, like, what do you want to use your phone for? What is the goal that you want to use? Because then we can provide those trainings. Like if you want to learn how to do like FaceTime calls and things like that, we can show you how to do those kind of things and how to set that stuff up. Or maybe there's something you want to do that there's an app that's out there that we would be able to get for you and train you on. So it's really figuring out what actually the device needs to be used for and what the goals are, and then doing the training specifically for that person's needs.
It'll be neat to see too in the community collaboration portion of this program too, that will also include that inclusive tech training series that we had mentioned. And when we were developing this model and planning everything out and putting it together, we looked at a variety of trainings, on a larger scale to offer, but opening it up for anyone in all different levels of technology. So, having more entry-level trainings on, it could be basic of utilizing different features within Microsoft Word or on an iPhone, or, starting with more entry-level pieces, and then everything from more intermediate and advanced trainings too. But, opening up that to individuals, family members, parents and caregivers, staff, because then, we're all learning more technology as well. And, we didn't want to limit that to just individuals, because we also recognize too, there's so much that families and on the staff side, there's a lot of opportunity there too. So that, so those trainings will be rolling out here to later this summer.
That's exciting. That was one of the questions we had is, will you also sort of train parents to support the individual with their new tech?
We would be providing training materials and things, and the parent is welcome to join during tech trainings and stuff, but we would want to make sure that we're focusing primary attention on the individual on those one-on-one trainings. But like Gabrielle said too, we would have the tech training series too, which would be open to anybody.
And then every individual too, as they're going through those trainings, and then even after, when they have a good handle on tech and afterwards, there will be personalized training materials as well, based on any device that they have. Because we want to make sure too that, whether it's visuals or however those instructions, having those reminders to refer back to in the format that the individual learns best as well. So those will be additional materials too that will be with the individual afterwards.
Is there a private pay option?
So because of our wonderful funders, Productive Living Board, DD Resources and DDRB, and that's why, we talk through those eligibility pieces, but we're very, very fortunate for those 3 funders to be able to cover the cost. So there wouldn't be any additional cost or, tech that individuals would have to purchase. As long as they qualify for funding. We do have a spending cap, some limits that we have to have parameters within those funding marks, but the funding allows us to be able to purchase any needed technology for the individuals.
So if they didn't qualify necessarily, but wanted to privately pay, would that be an option?
Possibly down the road.
Yeah, possibly down the road. I would
Have to
say,
see.
yeah, we
Ah,
we're looking at trying to support many individuals over the
mhm.
span of a year. So maybe once the program is up and running and we have the infrastructure really built, because since we're still in development, then down the line it could look a little bit different and could kind of open up. But at this point, we do need to keep some parameters on it.
I will say when individuals reach out and inquire if, for whatever reason, if they weren't eligible, there's a lot of other really great programs. Missouri is technology first, and there's a lot of opportunities, but also Recreation Council of St. Louis, they are a wonderful partnering agency too, and they've done some great things with tablet initiatives. So, if somebody doesn't qualify or, whatever the scenario might be, we're compiling resources as well, because if it doesn't work with live tech, wanting to connect folks too. And same with, like initially if someone reaches out and, for instance, if you don't have internet access, we'd have resources to support those individuals in getting internet access, and then if they were eligible, and then from there, continuing with assessment and training. So but we want to make sure that those resources are available so that there's other options.
So what if you live in Jefferson County?
Oh.
Yeah, that I was going to say that hopefully that will be something that would eventually open up down the line. But with this, with the boards that we're working with and them being very generous with their funding and stuff, they're kind of splitting costs between all 3 of them. And right now they're helping us get the program up and running.
Yeah, so we don't have funding from Jefferson County at this time, but we would be happy to keep everyone updated if that changes.
Yeah, and you can also reach out to the Senate Bill 40 board there and let them know that's something you're interested in, and maybe that will change things down the road.
If you have a case manager as well, case managers are wonderful resources too. So if you're in Jefferson County, I'd recommend to contacting with your case manager, because DD advocates may have some funding options to cover whatever technology is needed.
Is there a support group for individuals to talk to others in the program to see if tech recommended to them might work for others?
That is a wonderful question.
It is a wonderful question. And I could definitely see the possibilities of this being something with our community collaboration, possibly being a tech group for people who might want to get together and work with tech. But I could also see just even within the ARC agency, but possibly outside agencies, as that communication and that collaboration starts happening, there could be a lot of interaction going on just through our program with other programs. So could open up the doors to more group collaboration. So that would be definitely something good for us to keep in mind.
Those will be a lot of conversations too in the agency tech collaboration meetings that will be forming as well. More on that agency level of communicating too of what's worked for some folks and maybe what hasn't worked so well. And then that's also a piece in Chris's role too. So as we're doing more assessments and seeing what works well and capturing that data, that's part of his role as well, that he's going to be looking at what the data is telling us too, and what has really been successful for folks. And if there's pieces that come up that maybe that wasn't the best option, but so not any formal support group at this point, but a lot of those natural conversations happening in the agency collaboration meetings, and then as well as in some of those tech trainings too.
It's a great idea. We have a group of small itty bitties that use augmentative communication devices and they meet. So that certainly could be something down the road. Thank you all for being here.
Yeah, thank you very much.